Wellness Wednesday webinar. My name is Katie Powell. I am a Care First Wellbeing Consultant, and I'm really glad that you've joined today. Last month, if you were here with us, we focused on mental health. We learned that stress and burnout can affect your whole body, including your oral health. Things like poor sleep and high stress can lead to skipped brushing, late night snacking, and even putting off dental visits. That's why today we're connecting the dots with dental health. We are continuing our journey this year of achieving a healthier you. Did you know that your mouth often reflects how you're doing overall? I did not. Taking care of your mind helps your mouth, and taking care of your mouth supports your confidence and your overall well being. I am so honored today to have the privilege to introduce our guest speaker, Dr. Gale. Dr. Gale serves as the dental director here at Care First. He has been practicing dentist and dental consulting for over 30 years. He has seen patients here at home as well as all over the Western Hemisphere. He still gets excited about dentistry after all these years because it's not just about filing teeth or checking gums, it is so much more. Dr. Gale is working hard to incorporate oral health as a key player in overall health and human well-being. Welcome, Dr. Gale. Thank you so much for being here, and I'll pass it over to you.
Awesome. Thank you so much. Hey, everybody. Thanks for coming. I'm going to try not to bore you to death. I hope everybody brought something to snack on. And if you did something good, please feel free to share. My stomach may start kind of rumbling while we're going on here, but I just have a few slides. And so what I'd really like to do today is kind of talk to you just a little bit of basic stuff about your oral health and how it kind of connects to the overall well-being, how we're doing systemically with other areas of our health, and just make us happy, healthy, and hopeful, and as we kind of add these things to our daily habits, we just improve our lives. We become happier, more productive members of society. So we're just going to kind of go through some slides. If anybody at any time has any questions, just put them in the chat and we'll just jump in and make it more conversational. I just want it to be fairly casual. I want everybody to enjoy it. So I tend to talk a little bit fast. I had to give a presentation at, my wife and I do a lot of mission work. And so I did a presentation for the World Humanism Conference. And I was supposed to do an hour. And so I was super nervous, big crowd. And I got up there and did my thing. And I came back and sat with my wife and I said, "How did it go?" And she said, "That was great. 17 minutes. So if I talk too fast, just somebody yell and tell me to slow down. So we can kind of start with the first slide. Let's do it. All right. Pop quiz to start with. How many folks are walking around with dental decay? What do you think? Do we have a drum roll, Katie?
Maybe we should add music. That's such a good idea.
Jeopardy theme. I can hum it.
Just kidding.
Tough question. Wow, pretty smart folks. Pretty smart folks. Very good. All right, let's find out the answer. Drum roll, please. 1 and 4. So let's say, how many people do we have in here, Katie? 200 and 260. So
Good job, yeah.
52 people in this meeting today have a cavity. And most of them, Oh, we don't even know, we don't even know. They're just kind of sneaky, sneaky little boogers. And I'm assuming that everybody in here is kind of grown. No teenagers, no small children. So these are generally the sneaky little kind of cavities that we would obviously find on a checkup, a normal checkup. So good idea to kind of take a look around and say, man, am I one of those 50 people, or I just went to the dentist? I know I'm not one of those 50 people. So yeah, but cavities and gum disease is it's the most common disease worldwide. Worldwide of anything else going on out there, it's tooth decay and gum disease. And so we don't really think about those things because they're not sexy, they're not newsworthy. But these are things that affect us in so many different ways. It's not just about, oh, I have a toothache, or oh, my gum bleeds when I floss my teeth. You'll see as it kind of goes along that it has an effect on so many different things. And obviously, if you're a grown adult and you have had a toothache, I'm telling you, there ain't nothing like it. You can stomp up and down and you can holler and you can cuss and you can run down the street. It still hurts. There's just nothing you can do to make that pain go away. And there's just not much need for that anymore in this day and time. We have fantastic diagnostic tools that we can use to eliminate those problems before they even start. So I'm telling you today, if you've got dental insurance, use every dollar of it. The preventative stuff, the diagnostic stuff, use every cent that you have in benefits towards that. It'll save you heartache and expense. Heartache and expense. All right, Katie, let's go to the next one. All right, so why does it matter? Well, there's a million bugs going all around in your mouth, right? We've got obviously 700 different kind of bacteria that live in your mouth, and some of them are good. Most of them actually are good, but there are bad ones kind of hiding in there. So, without being over simplifying, it's really a basic process. We have bacteria in our mouth and we put food and drink in our mouth. And so the bacteria that kind of live in there are keeping everything kind of healthy. The healthy ones are kind of fighting the bad guys, and there's this sense of harmony that just kind of goes on. But once we introduce something into our mouth, whether it's food or drink, then those bacteria act differently. The bad one that's kind of going around and causing most of the trouble is the Streptococcus mutans. It's the one that causes cavities. It does a lot for your periodontal health and your gums. It kind of lives in your mouth. It just kind of sits around waiting for some sugar. And so a lot of folks say, well, I don't eat sweets. I don't have a sweet tooth, but man, I'll eat some French fries, or I'll eat some potato chips, or I really like popcorn. And all these things that are carbohydrates, they're all sugars. So we can call them carbohydrates, but they're really sugars. Sugars are just refined carbohydrates. So once you introduce those things, it gives those bad bugs fertilizer. It's like putting lighter fluid on the fire, man. They love it. They love it. And so they eat those little food particles, and those food particles kind of break down into a little sticky film, a plaque that kind of forms around your teeth. And so super easy to kind of clean that off with all the smooth surfaces of your teeth, outside where your lips are, on the back side where your tongue moves around, and those kind of things. So as you're chewing and as you're eating, those things just kind of get cleaned away, pushed away. But in between the teeth and down around the gum line, those areas don't get really touched by our normal, chewing habits and talking. So we've got to kind of brush those things, and they love to hide in there. You kind of think about your mouth as a cave. It's just a dark, wet, bacteria-filled environment. It's perfect for bad guys to hang out. And once they hang out and they start eating away at this little plaque, they created an acid. So everything, all God's children's got to poop, right? So they eat all this carbohydrates and they excrete an acid as a byproduct of that. And that acid is what tends to break things down. It not only breaks down the enamel, if you think about the enamel of your tooth being like a glass structure, it's hard, super duper hard, but it's a little bit brittle and it's a little bit crystalline in structure. And if you pour acid on that, Everybody's seen frosted glass, how it looks a little etchy on the outside. That's what happens to your enamel. And instead of it being a smooth surface, it becomes this little porous, stickier surface, which then becomes easier for these plaques to adhere to stick to hide on, and kind of creep in there. So we know that that bacteria, if it's not disrupted, either by a toothbrush, by your tongue or your cheek, hitting it by a crunchy, let's say a carrot or an apple or something like that, kind of scraping up against there, flossing, then they form these little colonies that stick even harder. And so once those plaques are there for a long enough period of time, the calcium and phosphorus and all these other little elements and electrolytes in your body form these little hard crystals. Those plaques turn into little hard plaques, and that's called tartar or calculus. And those you can't just remove with your toothbrush. You have to go to the dentist or out to your shed and get a little flathead screwdriver and start spraying on your teeth. They really get stuck on there, so you need to go to the dentist and get those things cleaned off. So yeah, feed on the sugars. So even though you may not be eating sweets, I tend to have a sweet tooth. I love sweets. But carbohydrates of any type give those bacteria all the ammunition they need to go. So all right, let's go to the next one, Katie. All right, so here's what we know. In the past 10 years or so, there have been a lot of studies by a lot of different people. And we all know you can make data, and manipulate it in a way that's kind of good for whatever cause you're trying to prove. But these things are infallible facts that just kind of go on. The bacteria in your mouth is related to so many health problems in our entire body. So just one of these studies has shown that gum disease, periodontal disease, constant inflammation is a cause of heart problems in most adult humans. So 2 to 3 times more likely to have a heart attack if you have gum disease. So that's one of the reasons that we want to keep those gums healthy as well. It's not just about saving your teeth. Chronic inflammation from all this bacteria plaque buildup causes higher blood pressure, coronary artery disease. So you can kind of tell, your gums get a little tender, a little red. That's normal stuff. A little gingivitis, you brush a little better, you start flossing a little better. Maybe, you're a little bit more diligent with it. And those things get better. But once they really start bleeding, excuse me, they start separating from the tooth a little bit more, that becomes periodontal disease, and those bacteria are stuck further and further down between the gum and the tooth in areas that you just can't get to. There's no possible way for you to manipulate a toothbrush or floss by yourself to get back there and get all those things out of there. And that's one of the reasons dental care is so important. So we can kind of go on to the next one, Katie. I assume you're driving, Katie. So oral health and diabetes. Diabetics get picked on a lot. Every health problem in the world. Oh, if you're diabetic, you got to watch out for this. You got to watch out for that. The truth is, if you do have good dental care, you take good care of yourself at home, and you do regular checkups, you're no different than anybody else. But unchecked, these problems can be exacerbated. So let's just look at the stats here. 60% of adults went to the doctor, but they didn't go to the dentist. So, why is that? Well, nobody likes the dentist. I've been doing this for a long time, and you have to kind of develop a little bit of thick skin because the majority of people that I saw, they'd start out the introduction by, I hate you. I hate the dentist. I hate being here. I hate everything about it. I hate the smells. I hate the sounds. I hate driving here, So we get it. We understand. But it's just kind of part of the process of staying healthy. And the earlier you go, the more you stay on top of it, the easier those appointments are going to be. So you don't have the dreaded, oh no, I have to go get this horrible procedure done. You're just going to get your teeth cleaned, and it's a fun visit, and you've saved money in the process. So diabetes can affect your mouth by changing your saliva. All the enzymes in your saliva that help break down those foods are the same enzymes that kind of break down the carbohydrates into those sugars and get the bugs going. But if you have changes in your saliva, that saliva becomes a little thicker, the plaques become a little bit thicker, a little bit stickier. Dry mouth equals a sticky mouth. Sticky mouth means icky mouth, and you can't just wash it down with a Mountain Dew or a Dr. Pepper. You know, you have to kind of get in there and clean these things out. So if you are a diabetic, you have good control, you know, you take good care of yourself, you watch your sugar, your A1C, you pay attention to those types of things, and you have a good diet. These things aren't going to affect you. It's the diabetics that fluctuate with high sugar, low sugar, maybe don't stick to a very strict diet, you know, and these processes of cavities and gum disease can really flourish. So especially if you're diabetic, really take good care of those teeth. You know, I've taken out a lot of teeth in 30 years, but I've taken out probably as many healthy teeth with no cavities, no problems. But because of periodontal disease, the teeth just had no more support and were just wobbling around, you know, so I had to remove those teeth. I've taken out just as many of those as I have bad teeth in good, healthy gums. You know, if you've got a really bad cavity and it's just beyond repair and we have to take it out, you may have fantastic gums, but you had a bad tooth. I've taken out just as many healthy teeth with bad gums. So it's a big cause of tooth loss. So it's slow and sneaky, you know, and once the gum and bone get inflamed with these bacteria, they start shrinking away. It's just like anything else. If there's an assault, if there's a siege at the gate, everybody starts retreating, right? And so all these bacteria are kind of hiding right at the neck of the tooth and the gum where they meet. And the gum and the bone kind of get puffy and they start shrinking away. They don't like that at all. But once the gum and the bone shrinks away from the tooth, it ain't growing back. There's no biological way that that tooth can grow back. Now you can go back and have gum grafts where we actually put new gums on. You can go back and have bone graft surgery, but all those things are complicated and they're expensive and they're uncomfortable. So if you can just keep what you have, it's like the old saying goes, you never know what you got until it's gone. So I always use the analogy of a old fence post. You know, I have a little farm here in Georgia and we've got a lot of fence. And so as we get storms and get a little gully washer and the rain comes, it washes a little bit of that old red clay dirt around the fence post, and before you know it, you can wobble those things around. And so the fence post may be fine, but the hole supporting it just isn't what it used to be. So take good care of those gums, especially if you have diabetes, and really, you know, not only for your overall health, but for your dental health, really keep an eye on your glucose levels and your A1C. So let's do the next one, Katie. All right, pregnancy. So I don't know, you know, let's say right now there's 237. Let's say half of you are female, and let's say half of those have had children. So, you know, some of you have been pregnant before, right? I've not been pregnant before, but I've treated a lot of pregnant folks. And sometimes what we'll notice is in the first trimester, especially, the gums get super puffy, super red, super easy to bleed. And it's just a hormonal change that's going on in there. Perfectly normal, not a big deal, but it can be a little tender. It can cause tooth sensitivity and things like that. But it's one of those things that it's helpful if you come to the dentist, let us make sure that it's just pregnancy gingivitis. It's just a hormonal change. We're keeping everything healthy, and it's not the start of some other problem that may cause you problems down the road. So cavities can form during pregnancy. You know, your whole focus is on delivering this healthy baby and what the future holds. You're not necessarily taking the very best care of yourself. And so cavities kind of form once you start having these cravings. Let's say, you know, some folks crave dill pickle, some folks crave Chick-fil-A, some folks crave ice cream, you know. if you happen to have some of those cravings and you, excuse me, find yourself, with a fun bag of Snickers bars every night, just kind of putting those things away. It's just good to recognize, okay, I'm a little bit better with my brushing and flossing just to make sure, I'm healthy and happy when this baby is delivered also. So a lot of pregnant women have GERD or some type of reflux or morning sickness. Sometimes it does cause vomiting. Sometimes it's just this acid reflux that kind of continues on and on and on. So originally, when they started talking about these problems causing tooth problems, my thought was it's the acid in the vomit. It's whatever's coming out of your mouth and touching those teeth that's causing problems. Well, that's true. But it's also the gas from your GI tract that is escaping through your mouth all day long. Every time you talk and every time you breathe, every time you swallow, that gas is coming back up out of your mouth. And just the gas they have measured is so acidic that that assault on your tooth enamel is also detrimental too. So all these things that we see are just kind of interconnected, the knee bone's connected to the hip bone and, it goes on and on and on. And so we're just finding all these connections that as you'll see, throughout not just a Care First insurance thought processes, but overall in healthcare, there's a connection, between everything. And I kind of like that, too long it's been that you have real insurance for your real health problems, and sometimes you get dental and vision too, it should be something that we all kind of think, oh, hang on, I've got these benefits, and so I'm going to use them not only to get my money's worth, but to get the very best health I can get, hey, why not, right? So once we find out that these things are connected, you'll find that every dollar you spend in your dental benefits towards dental will save you money on your other health insurance costs. And I'll get to that in a little while. All right. So all healthcare, even dentistry is safe during pregnancy. So I've had a lot of pregnant patients come in and they're like, well, I don't want any x-rays, I don't want to do anything to the baby. I respect that. I don't have any problem with that. That's your, your feeling, and there's no way in the world I'd convince you otherwise. Studies have shown though that it is safe to do x-rays, to do dental anesthesia, do dental treatment at any point during pregnancy. If you are hesitant, listen to yourself, listen to that little voice inside your head. Still go and get checked out, but if you would rather not have x-rays or dental anesthesia at that time, your provider has to respect that. You certainly got a say in your own healthcare. And so a little bit about pregnancy too is these hormonal changes are what's driving the change, cravings and snackings, morning sickness, gum disease. And so we know that gum disease is associated with preterm birth, low birth weight, taking, care of your mouth is the best way to go. So let's talk about this as well. We already know that the bacteria in your mouth can be transferred through your bloodstream and cause these cardiac problems. We also know that bacteria or infection in your mouth can travel through into the breast milk. So if you're nursing your baby, the healthiest thing in the world you can do, right? But you're transferring these bacteria over. A newborn baby is born without any bacteria in their mouth. That there's no teeth for the bacteria to hide on, right? Some babies are born with teeth, but not many. But it's what we introduce to the baby that establishes those bacteria colonies in there. So it could be breast milk. It could be, hey, I'm using this spoon and you can have some of mine. It could be anything, but we transfer those bacteria to the newborn babies, and that's how it becomes colonized in there. So yeah, dental treatment at any point is safe. And I always tell my pregnant patients too, obviously, you've got bigger fish to fry. You've just had a baby, life is wonderful, it's magical. You're protective, you're mama bear, you know, you're at home taking care of this baby. But once you kind of get out of that stage, you start bringing the baby around. Bring the baby to your next cleaning appointment. There's always a dental assistant that loves to hold babies. There's always a staff that would love to see them. But once they get up into the 1 year old, you know, kind of thing, bring them with you. Let them watch you get your teeth cleaned. Let them know that it's not a horrible experience. Everybody's friendly, glad-handed, smiling. They brush your teeth, you know, will give the child a toy. It's a fun thing. You know, when I was a kid, growing up here in Lower Appalachia, man, you didn't go to the dentist unless you had a toothache. And it wasn't a pleasant experience, I'm gonna tell you, you know, it wasn't good at all. And there was a railroad track that went right through my hometown. The only time the car ever crossed that railroad track was whether we were going to the dentist or whether we were going to the hardware store. And I could be sitting in the back of that car and I'd feel that railroad track bumping and bump, bump, and I'd immediately start bawling my head. I just knew we were going to the dentist. And it was horrible, horrible. And so then that fear in me is passed on to, you know, my brothers and sisters. My mother had a fear of the dentist, and that became my fear, you know. So if you make it a great experience from the beginning, make it a fun place to go, a happy, safe place to go, the child will have better habits, better care of their teeth from then on. You just make a lifetime great patient. So, Katie, let's go to the next. Am I talking too fast, everybody? You okay? Is my accent getting?
You're doing great.
Okay.
Yeah, if you could just speak up just slightly, I think that would be wonderful.
Oh, I'm sorry. Yeah, yeah. Is
No,
this
you're
better?
great.
All
Yeah.
right. So, oral health during pregnancy. Oh, next one, mental health in your smile. So mental health, we always think about mental health in really a couple different areas, black and white, really, right? That you're either healthy mentally or you're not healthy mentally, but there's a huge spectrum of different times in our lives, different seasons in our lives, different days in our lives that all these things affect us. And it can affect what we do with our daily habits, whether it's diet, whether it's hygiene, whether it's our attitude towards a positive well-being. You know, all these things are always in a state of flux. But there are some long-term chronic depression syndromes, anxiety syndromes, these other things that we know through study after study after study affects our hygiene practices. So here, those with severe depression are over 2 times more likely not brushing their teeth twice a day. So that's assuming that everybody brushes their teeth twice a day. And let's be honest. Let's do can we do a little thing here? Everybody, are you at a desk or have you got a pen or something like that? Let's use a pen because nobody's got a toothbrush sitting at their desk. And if you just take your pen and pretend it's a toothbrush, kind of hold it up. And so let's split your mouth into 4 different quadrants, right? Your upper right, your lower right, your upper left, your lower left. And so take your pen and we're going to brush the upper right quadrant first, right? So I'm going to do it and you kind of go along with me. So 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010, 1011, 1012, 1013, 1014, 1015. Okay, that's 15 seconds. If we do that over just those 4 quadrants, we've only brushed our teeth for 1 minute. We're supposed to brush our teeth for 2 minutes, 2 times a day. Realistically, there ain't many people who do that, right? But studies have shown over and over and over that that is best practices. So let's say you don't do best practices, but you still brush your teeth. While you're doing that, make sure that all that toothbrush is hitting every little bit of those teeth, not just your teeth, but your gums, not just your gums, but your tongue. You know, make sure that every time you feel that toothbrush, you can feel those little bristles on your gum, on your tongue, everywhere, and cover all surfaces of your teeth. And so we know if you're depressed, you're not going to spend the time or take the effort to take care of those things in a purposeful way. If you're anxious, you're not going to do that. You don't have time to do that. You can't stand to do that, you know? And so these things affect us. So the medications that we take for depression and anxiety, the two biggest mental health syndromes that we see today, cause dry mouth, right? So antidepressants cause dry mouth, anti-anxiolytics like Valium, Xanax, those types of things cause dry mouth. And so once you have a dry mouth, we know it gets sticky, icky, not good, right? So if you are afflicted with some type of eating disorder, you have bulimia, anorexia, all these things cause differences in your bacterial flora in your mouth, which can cause erosion of that enamel. It can cause inflammation of those gums. So there again, something to be extra diligent about, you know, super diligent, even though you don't feel like it, it's the right thing to do. Now, knowing that as a health professional, we have to know, look, you know, you've got some depression. We understand you're not going to brush as well as maybe somebody who's not depressed. Come see me a little bit more often. Let me make sure that you're doing okay. Let me take care of the things that you're not able to do at home. So let's work together just to make sure we can keep you as healthy as we can. So, there are a million things about mental health that affect our overall well-being, and oral health is just one of those things. We know that smiling is good for everybody, right? It's contagious. We kind of spread that joy, but we can also spread, you know, a little depression too. So smiling triggers dopamine, serotonin, all those feel good, you know, chemicals in your body. If you've not got a beautiful smile, you're not going to smile as much. So all these things affect our self-esteem, our positive attitude, and those things kind of cycle depression and anxiety. So the more we can do to improve those things, the better off we get. All right, Katie, let's do the next one, please. All right, common conditions. I'm not going to bore you to death with what a cavity is, but let's just take a look at this tooth. And this goes through our life stages, right? So a cavity is a hole in your tooth, a hole or a depression or a little opening in your tooth. And most often, when you're a kid, you'll get cavities in this little chart here on the top where it says Pitt and Fisher cavities. That's what we most commonly see. You don't have a whole lot of teeth as a kid. You're still getting your permanent teeth, you're losing some baby teeth. So those are the cavities that we see. Now, once you get into teenage years, the one on the left-hand side, smooth surface cavity, right there on the side of the tooth. Once your teeth start kind of getting squeezed together and you start growing, that's where we see these little cavities start. So teenage years, for sure, we're going to see a million cavities just like that. That comes from the teeth touching each other, the plaque having a fantastic place to hide in all that little area there. We know teenagers not flossing like they're supposed to, and that's where we see those cavities. And once you get old, like me, your gums kind of start shrinking away. You know, the old expression, long in the tooth, is because your gums have started shrinking away from the tooth and your tooth looks bigger. So that's where that root surface gets exposed. That's a vulnerable spot to get a cavity, right where the gum meets the tooth. And we'll see those later in life. All right, Katie, let's do the next one, please. All right, so we've got a beautiful chart here of gum health. So number one is healthy gum tissue. And if you've been to the dentist and they've taken that little probe and kind of poked it between your tooth and your gum, and they're calling out of these numbers, 2, 3, 4, 1, 2, you know, whatever. We'd love for those numbers in a healthy gum to be between 1 and 3. That means I can slide a little probe between the gum and the tooth, touch your bone, and that measurement is 1 to 3 millimeters high. If your gums get puffy, that measurement might be 4, maybe 5 millimeters, but the bone is still there. I can still touch the bone, but I can see this red gum that's inflamed and kind of puffy, so it makes that number a little higher. Now, once that advances on to periodontal disease or periodontitis, the bones start shrinking away, the gum starts separating. So I can take my little probe and I can stick it down there, and now it's 5, 6, 4, 7. You know, I get all these numbers. And that means my bone has shrunk away and it ain't coming back, you know? So I've got to be extra diligent about going to the dentist because that little yellow area around the neck of the tooth down there, right by the gum, is that tartar and calculus buildup where that plaque becomes hard. You can't brush it away. Your toothbrush bristles aren't touching it. And so we've got to kind of scrape that off for you and keep that as healthy as we can. We can still keep these teeth healthy. We can keep them for a lifetime, but you've got to be diligent about your dental care. So let's do the next, please. All right, pop quiz. What is halitosis known as? Anybody? Oh, we have a real test. This is great.
Need our Jeopardy music again.
Oh, yeah, yeah. And the answer is, yay, man, we got a smart group. Smart group. Halitosis, also known as stank breath, right? You remember the commercial? It's been years ago, but it was for mouthwash or toothpaste or something like that. But the person talking had bad breath, and there's this green cloud that kind of comes out of their mouth like a fog, you know. We've all smelt it. Sometimes we've had it, you know, and so sometimes it's a dietary thing, you know. Hey, we ate a bunch of garlic. I had some onions on my sub, whatever it is. Um, but sometimes it's from the bacteria in our mouths. So halitosis, known as bad breath, we know that if you smoke, it dries out your mouth, it changes your saliva, it causes poor oral hygiene, and those gums get puffy. That causes it. If you've got periodontal disease, that bacteria in those pockets cause it. Sometimes you'll notice someone has a mothball breath smell, and that is the bacteria of that periodontal disease kind of kicking in there. It has a camphor release, so you can smell that. Dry mouth. Hey, if you're asthmatic and you use an inhaler daily, those things dry your mouth out tremendously. It's super important to rinse your mouth every time you use an inhaler, whether it's a maintenance inhaler or a rescue inhaler. If you're using a rescue inhaler, hey, it's low on your list that I got to rinse my mouth right away. But the first thing, you know, it's a good idea to do that, especially with the daily inhalers. Tobacco, marijuana use, we see that a lot now that it's become legal. Folks will tell you that they don't smoke, but they smoke marijuana. And so for us, it's the same thing. You know, I'm not the cops. I don't care if you smoke marijuana. You just got to tell me so I know what's going on, right? Tooth sensitivity is kind of what gives dry mouth its big thing. Not only cavities, but one of the most common complaints we get is my teeth are so sensitive. I can't enjoy ice cream anymore. I can't enjoy a super cold drink. On a cold morning, if I breathe in deeply, it hurts my teeth so bad. And all these things are from dry mouth, and it really causes a quality of life issue. All right, let's do the next one, okay? Let's do some prevention, right? So everybody ask yourself a honest question. Be honest with yourself, right? Nobody's gonna know. We ain't lying to each other. Do you brush twice a day? And if you do you do it for 2 minutes a day? And do you floss every day? I'll be honest with you. I floss when I get a popcorn hole stuck in between my teeth. I'm pretty good about it. I'd say 3 times a week. But I do not floss my teeth every day. And every time I go to the dentist, I know my appointment's coming. It's next week or so, and then man, I'll get to brushing like crazy. I get to flossing. You know, I'm like a maniac. My gums are bleeding all over the place. I've hurt myself because I haven't done it enough. So, yeah, please let us know on this poll. Nobody's gonna know. We're not gonna call you out.
I have to ask though, aren't we supposed to floss daily?
Yes, we are. Yes, yes.
I do.
Well, see, you're doing right.
I need a gold
Some things
star.
I do as I say, right? Some things I do. Yeah, I mean, all of us, we're just human beings, you know. We just do what we do, but you might as well be honest about it, right? I can pretend that I do. I brush daily, but only floss sometimes. Hey, so I'm in that category. Katie, where are you? You're in the like 20%. Good for you. Good for you. All right, so another thing with your toothbrush. I brush pretty good. I use a soft toothbrush. That's what we recommend. My wife likes a harder, medium toothbrush. And after about a week, it looks like she's been scrubbing the grout in the bathroom. It is so frayed and like you could have scraped it on the sidewalk outside. It's horrible looking. And she thinks that's good because she's brushing her teeth good. Well, she's got some gum recession and she's got some sensitivity because she's just going at it too hard. So I say all that to say, use a soft toothbrush, change it out about every 3 months. Anytime you're sick, hey, if you've got a virus, if your kid has strep throat, throw your toothbrush away. What are they, $5 or something like that? Or your dentist is going to give you one every 6 months anyway. Get another toothbrush. Let's keep them clean and let's keep them soft and let's take good care of our teeth and our gums. Okay, let's do the next, please. Yeah, that don't skip the gum line thing. Flossing, yeah, it matters. And so here's what most folks do. They get the floss, wrap it around your fingers, or now you're using those little flossy pick things, right? Because you see them in parking lots everywhere. Like all of a sudden there's an emergency. I have to floss my teeth in this Walmart parking lot, so I'm just going to throw my stick out there. Anyway, you wrapping your floss around there, or you're using one of those sticks, you just jab it in between your teeth, pop it up and down. And what you're trying to do is get some of that pot roast out from last night, right? That just got kind of stuck in there and you're not getting it out real good. The proper way of flossing is to kind of slide it in there, sliding it back and forth, and then form a C. Hook it around, like let's say you're doing your top molar. You stick it in between there and then pull your floss forward with your two fingers, make a little C around that tooth and just kind of give it a little wiggle. You don't have to saw back and forth. You're not cutting your gums off. And then wrap it back the other way and then just pop it out. Be gentle, but once you stick the floss in there, it disrupts that bacteria colony. All those colonies are sticking together. They're like a hive of bees, right? They're just sitting there buzzing around making their honey. These are making acid. But every time you flop that floss in between there, man, they scatter. They scatter like crazy. It's like hitting that hornet's nest with a stick. They're gone. And it takes them another 24 hours to recolonize. So as long as you get in there and disturb that, life is better. Okay. All right, let's do the next. I'm talking too much. Sorry. All right, sugar and acid. Real easy equation, right? Sugar, we know is bad. Carbohydrates are sugar. So don't, if you're eating mashed potatoes all day long or macaroni and cheese, it's the same thing to the bacteria as if you're eating, Smarties or Skittles. They don't know the difference. They're breaking it down. And once they kind of eat that bacteria, man, they're loving it. They're loving it. They're thriving. They're reproducing. They're building colonies. And then they excrete this acid. That damages everything. We're talking about tooth, gums, everything. Then that process continues and continues and continues. So our job is just to disrupt that cycle. Certainly, it'd be fantastic if we all drank, pure water and all ate perfect diets. But in real world, that's probably not going to happen. So we've just got to be diligent about keeping that. Our mouth pH, our body pH is supposed to be fairly neutral. If we're going to say around 7. Acid is in the 5 range. Your stomach acid is in the 3 range. So if you start getting into those kind of areas, that's about the same as battery acid, and it will just eat those things away. So our saliva helps us, but we've got to get in there and disrupt those things. All right, Katie, next one, please. All right, healthy, healthy, healthy. Yeah. I'm not a nutritionist, so I know these things. Let's all eat healthy stuff. That's good. Here's what water does. We're all made out of water, right? And so everybody's drinking bottled water. When I was a kid, we drank out of the spigot in the backyard, or we drank tap water, and we just didn't know any better. Hey, it was good. It tasted like water. That water has fluoride in it. Fluoride's come under a lot of political commentation lately, and so whatever side of it you stand on, it's just been proven that fluoride helps prevent cavities. Now, it's also proven that it's a toxin, right? So way too much fluoride is bad. Way too much salt is bad. A little bit of salt makes things taste great. So everything in moderation, right? But if you're drinking bottled water, it doesn't have fluoride in it. So just saying that you're drinking, oh, I'm drinking water. Well, it doesn't have any fluoride in it. So maybe the only fluoride you're ever getting in your body is from your toothpaste. Don't swallow it, just brush it. Water is essential because it does. It washes those things away so much better. So if you're a Diet Coke fan, hey, I just love to sip on a Diet Coke all day. That's great, but it's got a little bit of acid in it, you know, and so it doesn't sweep away the bacteria the way that water. It kind of pronounces that acid in it. Water will neutralize the acid, keeps your mouth slickety slick, keeps your whistle wetted, and you know, we're eliminating some of these problems already. So we know when the mouth gets a little dehydrated, those plaques get sticky. Not good, right? We want to keep them all juicy. So let's go to the next, please. All right, let's go see the dentist. Visiting the dentist isn't about clean teeth. We've got problems, right? So we're going to solve gum disease, cavities, oral cancer, tooth grinding. You know, we've got ways of detecting these things. It's not, I'm just going to do a quick looky-loo in your mouth and let you know, all this information, but we've got fantastic diagnostic tools now that we can do. We can figure out a way of looking at your mouth and finding signs and symptoms of systemic problems that may be going on that maybe you weren't even aware of. I remember the first time I went to the dentist and they took my blood pressure and I thought, well, you know, you think you're a real doctor? What are you doing here? You know? But most times hypertension is found at the dentist office instead of the doctor's office. So think about that. There are a lot of those little things, but oral cancer screening, super important. Cavities, super important. I had just a quick little cavity story. I had a case that the medical directors and I went over last week. Sweet little lady, let's say late 70s, going to Costa Rica for a vacation of her lifetime, right? She gets down there, she has a toothache, she goes to the dentist. They say her tooth is infected. You've got a cavity here. She didn't know. It hadn't hurt her, hadn't given her any problems. Long story short, the fever, swelling, all this begins. She's absolutely miserable, goes to the doctor. They admit her to the ER. She's in ICU for 9 days. They have to do 3 surgeries in her neck to drain the infection, IV antibiotics. Cavities can be bad. I'm not saying that to scare you, but if it's easily detected and it's easily fixed and you've got dental insurance, why in the world would you not go get it seen about, right? Because we're scared. We're scared. So let's all man up or woman up and go get that done. Go see the dentist, right? So we're going to clean your teeth. We're going to do some x-rays. We're going to check it out. We're going to give you some pointers on how to better take care of them. You're going to have a better, happier life, I promise. All right, so let's do the next one, Katie. I'm talking way too much. I'm sorry.
Not at all. We're almost done.
Has everybody left?
No, you are holding a crowd. We got some good questions as well.
Oh, well, bring them on. Bring them on. I think we're done, right?
Yeah,
Resources. Yeah. That's probably important. Okay, brushing for 2 minutes. Katie, you take over the driving. I'm sorry, I'm talking way too much.
no, you're
No, I
fine. Do you want to finish
apologize.
this poll question real quick? Which of these habits would you most like to improve?
For me, brushing for 2 full minutes. Man, that's a long time.
You know, my trick, and I tell people this, we have to brush our teeth, right? Twice a day for 2 minutes. March in place while you're brushing your teeth, because that adds 4 minutes of physical activity times 7 days a week is 28 minutes. You multiply that by the month, by the year, and you're incorporating an additional good habit.
That's pretty good, actually. Plus you get your steps in, right?
Yeah.
That's not a bad idea. Huh.
Awesome.
All right, brush for 2 minutes, floss, make a C, don't jab it in there, right? You're not popping it in there. If you've got some pork chop in there, hey, dig that stuff out, man. But then you gotta floss the other teeth too. Don't just floss where you get a little something stuck in there, right? You got a little corn kernel from that corn on the cob this summer, get that out, but floss the rest of them too. Drink more water, get some fluoride, whether it's by toothpaste, or, you know, I'm not gonna tell you to drink tap water more. And less sugar, right? All right.
Absolutely. So before we go on to the Care First Wellbeing section, we would love to get a couple questions answered. There's a lot, so I'm just going to pick a couple. The first is, what is the truth about teeth whiteners? So we have folks that are saying they've used the crest strips, they don't think it's done much. They see the advertisements online, the powders and such. What is worth it? Or are expensive dentist treatments worth it?
Absolutely. All tooth whiteners are based on a product called carbamide peroxide. It's a gel peroxide. It's not hydrogen peroxide, carbamide peroxide, and they all work. But over the counter is a lesser strength than what we can do in the dental office. It has to be prescribed by a professional. So just like a prescription medicine, the higher the carbamide peroxide content, the whiter your teeth will get. Sometimes that causes a little bit of tooth sensitivity when you do that, but it's generally temporary. And we tell you to kind of drink a clear, you know, drink for the next few days. Don't eat blueberry pie as soon as you leave, you know, coffee, something like that, for a day. And then they stay white for a long, long time, sometimes as long as a year, depending on your diet. If you do drink a lot of red wine or berries, sometimes they'll stain a little bit faster. If you're a smoker, obviously they'll work. Pressed white strips do work, just not very, you don't get that wow factor like you would if you went to a dentist and got them power bleached, or, you know, whatever the term they're using in their marketing. But yeah, it's just carbamide peroxide.
Awesome. In your opinion, do electric toothbrushes clean more effectively?
Yes. Um, but I mean, you still have to put it on every tooth in your head. You know, you can't just turn it on and stick it in your mouth. I have a Philips Sonic Care, but I have used every one that they have. Oral-B makes a little round one, you know, it's kind of like the dentist office. But I think it's Crest makes one. It's like $5 or $6. You can get it at Walmart. It takes a AA battery. It goes back and forth, chicka, 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 and it also has a little spinny thing. I think it's called a Crest spin brush. They work fantastically. If you're arthritic, if you have trouble getting back to those very back teeth, or on the back angle on the tongue side of your lower, you know, wisdom tooth, these things help, because all you really have to do is get it back there and it will do a really good job of cleaning. I think it takes some of the dexterity out of it. So if you have limited use of your hands, your fine motor skills and those things, especially for older adults or folks with arthritis, they're magical.
Awesome. For time purposes, I'm just going to do one more. Is it okay to ignore intermittent pain in a tooth that comes sometimes with the pressure of chewing? I've seen the dentist recently and go twice a year, so no visible issues.
Yep. So yeah, yeah. This is a tough one. There's a real thing, and people who make a ton of money in a research lab came up with this term, cracked tooth syndrome. I know it's catchy, but a lot of times in the enamel, like I said, you kind of think about it like glass. It's this crystalline structure, super duper hard, but sometimes like glass or a diamond, you can get a small little crack in it. And that crack is fine. Everything's holding together well. If you hit it just right, sometimes when you're chewing, you hit it just exactly right, that crack expands and contracts, and that causes that sharp pain. You know, sometimes hot or cold. Our mouths are almost 100 degrees, 98.6 degrees, right? You drink a cold drink, which is 40 degrees, let's say. There's a huge temperature change. And I don't know, Katie, you're too young, but when I was young, they had these ice cube trays, and you'd fill them up with water and stick them in the freezer and they'd freeze. And so an easy way to get the ice cubes out was you run it under the sink and they'd go like that and shrink up. It's the same thing that happens with your tooth. And so that immediate change is what causes that sharp pain. So I have had patients complain. Ooh, when I bite down, this hurts like crazy. I look at the tooth, we take an x-ray, I'm banging on it, I'm picking at it, we can't find anything wrong with it. 3 months later, they come and a piece of their tooth's off and they say, I told you something was wrong with my tooth. Well, yes, there was something wrong, but it's just not visible to the naked eye, you know. So Yeah, just keep track of when it hurts you. If it becomes more constant, more intense, go back to your dentist and say, this is exactly when it happens.
Awesome. Thank you. There are so many questions, and I thoroughly have enjoyed this. I know
Keep
so many
going.
other people have. Yes, you held the crowd. Great comments. We are going to do a follow-up email, so we'll try to see if we can get some more questions answered through Dr. Gale. But Anne, if you want to go to the next slide. Just to really quickly talk about our Wellness Wednesday webinars. We just are wrapping up Q2, where we focused on protecting and maintaining our health. We looked at things like vision care, mental wellness, as well as today's topic, dental health. This next quarter, we're shifting gears to talk about seasonal changes as well as prevention. So July, we'll talk about summer safety, things like staying healthy and active while avoiding heat-related risks. In August, it's going to be all about back to school, supporting families, routines, and emotional wellness as we transition into the busy fall. And then in September, we're going to spotlight prostate health, which is a critical issue for many adults. And this will benefit awareness and early screening. So together, these topics are going to help us stay well in every season. Next slide. We only have a minute or so, so just as a reminder, you may have access to Care First Wellbeing, which is your personalized digital resource to everything wellness, from your real age health assessment, which I believe does ask questions about your oral health, personalized timeline feed, tracking capabilities, ongoing motivating challenges, health profile, and more. And in addition to Care First Wellbeing, all of those wonderful assets, we also have core programs that we offer. We have health coaching, both lifestyle and disease management pathways. We offer 2 weight management and diabetes prevention solutions. We have tobacco cessation. So if you are ready to quit and you want to improve your oral health as well, we can assist you. We do have financial well-being, as well as an exclusive discount program called Blue 365. And last but not least, if you are looking for more Care First resources, we have them for you. Everything from a preventative care checklist, a health library, and more information about our care management programs. I want to thank Dr. Gale for one of the most informative presentations. This was wonderful. I have so many tips and tricks that I'm going to share with family and friends. So I hope everyone felt it was just as amazing and valuable as it was. Dr. Gale, appreciate all of your time and effort. And I hope everyone has a very happy and healthy Wednesday and rest of the week. Thanks, everybody.